Thank you for logging on to today's webinar, Introduction to Dialectical Behavioral Therapy for Healthcare Professionals. My name is Marla Kaufman, and I am the Communication and Health Promotion Associate at IRETA. I'll be moderating our webinar today. I would like to go over some quick housekeeping items about how to use the WebEx technology and how to access continuing education credits. First, we would like to encourage you all to participate in today's webinar in a few ways. If you have questions for our presenter or are experiencing any technical issues, please use either the chat function or the Q&A panel to communicate your questions. Our presenter, Angie Richard, will take questions throughout the webinar. Feel free to submit your questions through the chat or the Q&A box at any time. This webinar is approved for 1.5 PCB and or NADAC credits, which are free. A certificate of attendance will also be available to download from your MyIRETA account. Please take note that it will take up to 48 hours for your CEUs and certificate to be available on your MyIRETA profile because we have to cross-check your attendance with WebEx following the webinar. After the webinar, you will receive several follow-up emails. The first will be an email that will include a link to an evaluation form for the webinar, as well as more information on how to access your certificate of attendance and continuing education credits. We will also send an additional email to remind you of the evaluation. I would now like to introduce today's presenter, Angie Richard. Angie Richard, MSW, LCSW, believes in the idea of knowledge as power, but only when shared. A licensed clinical social worker with an MSW from the University of Pittsburgh School of Social Work. As the clinical director, she is certified as a clinical supervisor and facilitator of EAP and corporate communication programs. She creates and presents webinars and provides real-world solutions with down-to-earth conversations, incorporating 19 years of therapeutic experience with timely topics and tailor-made approaches to your needs. Before I hand things over to Angie, I'd like to ask everyone to take a few minutes to complete a few poll questions, which I will open up right now. If this wants to load, just a minute. Sorry about this. All right, there we go. So please take a few minutes to fill out those poll questions. You'll get a warning when there's only a few seconds left. Right, it looks like folks are finishing up, so I'm going to go ahead and close the poll. It'll still give you a few more seconds. All right, Angie, I am going to share these results with everyone and hand things over to you.
Perfect. First and foremost, thank you so much for logging on. I'm sure we're all logged on for all sorts of different reasons. I know there's a lot of license renewal coming up at the end of this month, or hopefully you have some interest in dialectical behavioral therapy, or maybe you've heard of that, or maybe you're thinking of ways that you can incorporate this. Please know that this is genuinely the tip of the iceberg as far as dialectical behavioral therapy goes. my experience in working through this over the past 10 to 12 years, I can tell you that we just keep learning and learning. Primarily, though, I see in our polls that we have drug and alcohol and mental health seems to be the majority. So I want to kind of speak to that. Please, though, do me a favor and put in your questions. Let's talk about this. Let's make this a discussion so that you're able to get as much that I can give you in the time that we're here together. So ideally, what we're looking at when we're looking at dialectical behavioral therapy here is the idea that we have clients that there's some sort of resistance. And I don't really like to use that word because it's not so much that they're making this active choice that they just don't want to do anything, but it's the fact that there are so many other things going on. There's so many other barriers for them to change that it makes it very, very hard to put in all of our other good therapy coping skills and process work that we do to help that person move forward into living the life that they want. One of the things we look at many times is feeling as though we have the for lack of a better phrase, a COW, the COW, the crisis of the week. Or we may have a series of events or maybe systemic issues that are happening that are consistently agitating the situation or activating the person with their feelings and thoughts and emotions. And we only really stay on the surface managing these situations, whereas we are not able to dig down deep and look at some root causes. Again, like I said, this is basically a therapy approach. We've had this around since the early 90s with Marsha Linehan, and she's a phenomenal lady. I highly suggest you read up on her if you get a chance. But this is a structured set of skills. The greatest thing about this is a skill set that we find when we start talking with people and start utilizing DBT that many people did not have. How do people not get some of these skill sets, you wonder? Well, quite frankly, a lot of times when we're looking at DBT and we're looking at any type of emotional regulation that goes along with this, or looking at their thought patterns, a lot of this can be swirled up in some form of trauma or poor coping skills that happen along the way. Now, did they just want to use those poor coping skills? No, absolutely not. What they really wanted was just to be able to get through to the next day. And we find that with a lot of our people when we're looking at mental health or drug and alcohol, many have some form of trauma background. Maybe it may not be extensive through their whole childhood and into adulthood, but we generally find a few things that have really changed and colored the way that they look at things. So that being the case, you know, when they were supposed to be picking up these other quote unquote good coping skills, they weren't able to because at that point in time, they were trying to survive from where they were at that point, whether it was from them being a younger child or a teenager or a young adult. And those are things we also know when we're looking at addiction that many times you see that that cognitive framing and you also see those coping skills stop right around the time that the addiction really starts to bloom. In my previous work before I concentrated on mental health, I worked several years facilitating intensive outpatient program for our local drug and alcohol services here, and we saw that over and over again. Our clients many times had just stopped growing at that point, either like emotionally, cognitively, whatever it may have been, in order to continue to process and move forward. So this is basically a skill set. We're kind of like handing them a toolbox at this point in time. So as we go through here, you're going to see a lot of acronyms and a lot of different things to use. Again, this is literally just the tip of the iceberg. There's a lot of different things in place. And there are whole structured ways to run this. This can be run both individually and in group. Initially, it was done as part of a group process. However, I can genuinely say, having used dialectical behavioral therapy individually and in group, it works both ways. It just needs to have some adjustments depending on the person and the situation and the targeted areas. So basically what we're looking at here, and you see it's DBT, so it sounds like similar, right? Like we all know CBT, right? That's our kind of like our godfather of some of the therapies here. But DBT is kind of the cousin, okay? So this is behavioral therapy. So we're looking at, right, CBT, cognitive behavioral therapy, and this is DBT. So this is dialectical behavioral therapy. How they are related is the fact that we take CBT and we actually add the practice of mindfulness. Okay. We're looking at drawing that overarching worldview. Okay. We're looking at, instead of, in CBT, we have this issues with cognition relating to like black and white thinking, for example. In DBT, we recognize the black and white thinking, and we're also looking for a gray area or a middle path. So can it be both sometimes? Does it have to be one or the other? Because it is that rigid thinking many, many times that is activating our clients and continues to activate them, whether in their active use, relapse, or having activated symptoms relating to their mental health. Again, like I said, originally this was an intervention relating to self-harm and suicide through Marsha Linehan. She kept on seeing, and I really, really don't like this term. However, I do use it exclusively because many times when I say this phrase and looking at some of our people that are here that are on older, the phrase frequent flyer, that basically this is a client that is repeatedly coming in for the same services and it seems like they're not getting any better. So this is her frustration. She saw these people that were suffering and kept asking herself, why are they not getting any better? We're putting in all the right pieces, we're doing all the right stuff, but it seems to just keep coming back through. So that's when she started looking at doing things a little bit differently. Initially, this was identified for borderline personality disorder. And we use it classically with that. However, I can say as a clinician, I have used DBT across the board to manage many, many trauma-based behaviors and thought processes, as well as using it with some drug and alcohol work as well. So at the very core of this, there are 4 pillars of DBT. There are 4 things that you learn, and it basically goes in this order. We start with mindfulness. We have this person, so let's just think about it. Let's make a client. Nancy, for example, who comes in to your sessions and she's desperately trying to get things together and she recognizes that she's not doing well and her anxiety always seems to peak around certain events and situations, but she constantly is running at like a mid-level anxiety all the time. Because of that, this is now becoming an issue for her at work and at home. And her drinking has increased. It used to be a glass of wine a couple nights a week, and now we're looking at maybe a bottle. So at any rate, when you're looking at that, we're talking about this person who's desperately trying to do what they need to do to move forward, but they can't. They keep on tripping on getting activated over and over and over. And many times when we see this, one of the things that we recognize is that because they're constantly getting activated, we never really get down to that deep level of what's happening here that's driving this driving force, what's basically driving the bus that's continuing to activate these symptoms. We many times just kind of stay on the surface, right? And we talk about the week's events and look at those things. And it makes it very hard because, again, it feels like, what do I call it? A cow, right? The crisis of the week. Or maybe it's something where you're just dealing with these surface thoughts or ideas and you're not really able to dig down deep with our CBT or any, looking at any cognitive distortions or anything surrounding those. So we kind of have to start, and what do? We are ever and always trained to be strengths-based and meet the person where they're at. I can't emphasize that enough. That's what we need to do, and that's where we need to be in our practice, specifically with DBT. So we start with just basically just the person's body and just how they are oriented in the space that they are in. That is what mindfulness is. Now, I know that mindfulness has absolutely been like a buzzword at this point in time. And, everyone's like, oh, yes, we're just going to like do our mindfulness. And when you guys picture mindfulness, think about that. What does that look like? Are you kind of having like that stereotypical picture in your head of like someone just sitting there with like, their legs crossed and like some sort of like calming position and their hands out to the side and they're chanting? Or is it something where they just kind of close their eyes or do whatever? Maybe, maybe not. Mindfulness, very, very simply, is just shifting your thought and perception out of where your brain was, which is many times in some disordered thinking that is generating some depression or some anxiety, and shifting it into the present. Again, one of the reasons why we see our clients so activated over and over again is primarily because their brain is never right here, right now. If they're feeling very, very depressed, we find themselves in thoughts of guilt and shame and the coulda and the woulda and the shoulda, right? Or we find them very far in the future with, I need to do this and what if that and how about and oh no, what if? Okay. What we need to do is we need to work on locking our clients to be present right where we are right now. And many people that struggle with this really struggle with these huge emotions that come up because if they feel that they have to sit with this emotion may be too big for them. And there's a whole line of anxiety and anxious thinking surrounding that. So we practice. Please know, everything that you do a lot of, you're going to get good at. I cannot emphasize that enough. And so when you're looking at some of these skills, many times we talk to our clients, we're like, yeah, we're going to use these skills to help you calm down so that you feel better. That's awesome. But you really need to practice the skill before you get into the situation where there's a problem. So for example, with our leading Nancy, you know what I mean? If she's feeling activated at work because the boss is yelling and maybe somebody walked off the job and now she has more work, you know, that is not the time to start learning how to practice a DBT skill so that she doesn't relapse that night because she's just not been drinking for the past week. You know, realistically, we want to start practicing some of these DBT skills way beforehand so that when she needs them, they're in her back pocket. She can just pull that out and use it. So I cannot emphasize enough when you were looking at doing skill work with your clients, please, 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 please have them practice in session with you. Have them practice on very, very small things so that they can see some success. We are always and ever motivated by anything that we're gaining some success from, right? So if they're able to tackle a very small problem and do it well by using a DBT skill, they're going to be more apt to use it down the road and to practice it more so that when those really big events happen that will be triggering or may very well trigger a relapse, that we are at a point now where they can use that and they feel confident in doing it. So again, this is basically just to reorder someone's focus in someone's situation. So very quickly, while we're all sitting here, what I want you to do right now, where's your hands? Just think about it. Where's your hands? Are you sitting on them? Are they like, are you leaning your face on the side of your palm? Do you have a pen in your hand? Are they hot? Are they cold? Are you fiddling with maybe one of your rings? Right there, just right there, right what you did in the past, what, 10, 15 seconds? That's mindfulness. You shifted it off of, oh my gosh, I got to make sure I get this thing done after I'm done with this webinar with Angie. Or, oh no, I really should have gotten these things done. And now I'm going to, you know, have to deal with that later because I didn't get things turned in on time. We're not in the past and we are not in the future. We are just right here, right now. So like I said, the hand thing, by the way, that's a good one to start with your clients because that's something that they're going to able to easily orient themselves to. And there's a lot of descriptors around that. Just being able to notice what's going on. If you don't want to use their physical body, you can use objects in the room. I tend to go by shapes or colors. And you can say how many blue things are in the room or how many things that are circular do you see? Or I will go by some sort of descriptor. Look through the room and see if you can find something that is beautiful to you or something that is alive or whatever it may be. Those are another options to do outside of their body. Ideally, we'd really like to kind of start internally. And the reason why is because we see so much dissociation, so much checking out related to trauma, related to everything else that they're doing, that many times our clients don't even realize that they're checking out. They don't even realize that they're not being present. All they know is that they don't feel good. And all they know is that when their body is really, really activated, they know that something is happening, i.e. a panic attack, or they feel like they can't get out of bed, or they're so agitated that they snapped at somebody. So we start with our mindfulness. And kind of once we get that down pat, then we're going to look at some distress tolerance skills. And if you think about this, I bet to a certain extent, some of you guys already do this, or it's already implemented in some of your stuff. It just may not be called this. So we start with our distress tolerance skills. We look at basically how we're going to be able to handle having those difficult emotions. How do we learn to sit with this thought? How do we learn to sit with a wash of sadness or a wash of anxiety. Okay. What does that look like? And does that mean that you can do, are you doing something else to maybe just sit with it and be okay? Do we need to talk to somebody? Do we need to use some distraction? What do we need to do just to be able to kind of sit with this emotion right now and not feel activated and not feel impulsive so much that we're going to do XYZ, either, really bank on those suicidal or homicidal ideations, feeling impulsive and using drugs or alcohol, feeling impulsive and completing other acts that they don't want to do. Um, that's sex, that's gambling, overeating, all those things. You know what I mean? Or, is it something else along those lines? So we're kind of decreasing that impulsivity, but we got to get them in touch with their body first to recognize what's happening. And then we're going to work on a plan for that. Then we hop into emotional regulation. We're going to talk a little bit more about each and every one of these as we go through. And you can kind of take a look at that. I also put out some links as well so that you can see there's some specific workbooks and stuff like that that really break this down step by step by step for you to take a look at. When you're looking at emotional regulation, you're basically trying to lower the intensity of what's going on around you and decreasing and stopping those outbursts. So now this is actually a little bit more of where the CBT stuff comes in, right? Because we're looking at our thoughts, right? So, right, we have our thoughts and we have our feelings and we have our actions. So now we're starting to really look at what's driving the bus here. Why is this happening? We're looking for more of this middle path or this gray area thinking. Is it all black or is it all white? Absolutely not. Okay. I really can't think of too many things, honestly, in the world right now that are all black or white. So there's always a gray area. So how do we help our clients find that gray area? Because once we're in that gray area, we have a better understanding of what's happening around us. And on top of that, we also know that we really can't sit in a gray area and be highly agitated, right? So it's more of a calming area because we're trying to be curious about the situation. We're trying to be curious about what else is going on. And so being able to do that, allows us to start regulating some of those emotions as well. The last one that we'll talk about here is interpersonal effectiveness skills. When we're looking at interpersonal effectiveness, this is between you and whoever else you are talking to. This is all of those relationships. And I'm sure as you sit there and you think with your clients, some of the topics that you talk about, aside from recovery, I am sure number 2 is some form of relational conversation. Because their mental health and their ability to, stay in recovery, whatever that looks like for them, directly affects their relationships. And because of their mental health symptoms being exacerbated, or because of the recovery, not being a priority primarily, months or years or whatever before, we also know that a lot of these relationships have been damaged. So we're also looking at helping them build those things because, again, what are we doing? We are playing to strengths and we're going to meet that person where they are at. And that means that if we're looking at someone, for example, Nancy, that hasn't been talking to, her girlfriends at work, or hasn't been out and about, going over to, see her niece or whatever because she's too holed up in her house, too worried. We need to start working on that because some of those relationships are starting to deteriorate. And we also know that having those healthy relationships, those are the supports that they're going to be leaning on once they walk out of our door. And that's what ideally what we want is we want them to be able to have that resilience. I can't emphasize that enough. That is 100% what keeps us going. Having our resilience and our faith and leaning on those people around us. And by the way, when I say faith, I am not talking about just a Christian view or a religious view. I'm talking about faith in general, just that idea of hope that things get better, hope that we know things change. We also know that feelings are not forever, that things are temporary. So being able to have that is a huge indicator of success, right? So I'm going to pause here real quick. I went over a lot of information. Any questions or comments right now?
We don't have anything that has currently come in. If anybody has anything they want to submit right now through the chat or Q&A, please feel free. But it looks like you're good to keep going, Angie.
All right. So what are we looking at when we talk about looking at substance use disorders, right? This was, by the way, primarily the makeup of the group. So I really kind of want to address you guys as well. And what we're looking at as a couple of areas where we need to work on. One is to decrease the abuse of substances in general. Okay. When they're able to have other skills that they can rely on, what happens? Oh, now I can use this. And maybe it's not perfect every time, but, instead of drinking, a bottle of wine at night, maybe or every night, maybe I'm only having like a bottle of wine once a week. Maybe we're not quite to the point of abstinence. We really want to get there. That's great, but we're working our way towards it. These are some of these skills that we can use to help push them to that point. Also, too, alleviating any physical discomfort relating to the abstinence and withdrawal. You and I both know that when we are seeing our clients go through detox, especially within those first 10 to 15 days, that there is so much more going on there, and it is very distressing. On top of that, once people get into recovery, they feel pretty good, right? After like that first month or so. But then when they really start living their lives and really start working on those routines moving forward, what happens? They start running into new obstacles and barriers, and people see them differently because maybe they were an alcoholic for 30 some years and now maybe they're not. And so now they're being seen differently and their relationships are changing. So how do we help them work through those big feelings and those big washes of emotion? Also, too, looking at being able to diminish cravings, temptations, to use so on and so forth. Again, when they can recognize that their body is activated and they recognize that it's activated related to a stressor and that they have other coping skills, at the least, hopefully it can delay their use. Also, too, we're looking at avoiding opportunities or cues to abuse, right? So what do we always talk about? This is in AA and NA as well, people, places, things. And these are all different types of triggers, all different types of things that can take someone back out the door to use. And that being the case, having these recognizing these opportunities where it can be a problem, okay, that's when we're able to kind of put some of the stuff in play and do some proactive work so that they're not basically stepping in these potholes. Also, too, looking at reducing behaviors conducive to drug use. Okay. So have the whole idea, or alcohol use, or whatever it may be, the whole idea of if there is this huge wash of guilt or shame, what's the next thought? See, I told you I couldn't do it. This is how it's always been. I'm worthless. I'm no good. So why should I bother? There's no reason for me to continue doing XYZ. What are you going to do? I'm just going to go ahead and I'm just going to take care of that. And I'm just going to go back to using because there's no reason for me to be occupying the space, or there's no reason, I'm not going to be able to get my kids back. So it's not really going to matter anyways. Why do I even bother? Looking at reducing those behaviors via looking at some of those thoughts and looking at some of that, like I said, middle path thinking that's related to DBT. That's a huge, huge deal. Also, too, recognizing that they do have some power, because all the language I just gave you before, right? All those hopeless, helpless thoughts, that's all related to how much power they believe that they have in a situation. They see all their power now being external. Everything is happening to them, okay? It is no longer, it's not an intrinsic thing. They don't feel that they have control over these things or things that they can do. So if that's the case, of course, it's going to make it much easier for them to step out and to relapse. Outside of that, when we take a look at some of these behaviors, if they feel that they do have some power, it's like, well, at the very least, I can fill in the blank. I can do some mindfulness skills. And then after that, I'm going to go distract myself by walking my dog, because I know that when I move my body, I feel better. I don't want to move my body right now. Right now, I really just want to go use, or right now, I really just want to go eat XYZ. But I'm just going to have that walk. I'm going to go do the thing. And then I'm going to see how I feel after the walk. So being able to put some of those skills in place and connect them with how they work and using them proactively before people get activated is huge. And that's also what DBT is about, as well as looking at increasing community and reinforcing these healthy relationships, right? So a lot of times we see these relationships being damaged, as I discussed before when we were talking about those interpersonal skills, right? We see these relationships being damaged over and over. Or we see relationships where the power differential is way off. Okay, we see primarily we see relationships where there's significant issues with boundaries. Boundaries, boundaries, boundaries. I can't emphasize that enough. Of the things that I talk about a lot and of the trainings that I do more of my training, quite frankly, on burnout, compassion, fatigue, and my second is ever and always boundaries. We see that this pops up over and over again, and especially in working within mental health and addiction related to their relationships and what those have looked like. Again, because they probably may not have learned how to hold good boundaries in the past because the people that they were surrounded may not know how to do that either, right? In a way, it's a little bit of that, what we call a generational trauma. So they just learned and did the best that they could with what they had at the time. Maybe their parents did, or at that point, and now our person now is just doing the very best they can with what they have at the time because that's all they learned. Okay, skills, skills, skills. Once we get these skills rolling, they can pull some of this stuff down. They can start to regulate themselves better. They're really enriching those relationships around them. It's going to make it a little bit easier for them to cope. And then once they're coming to see you then for therapy, mental health, drug and alcohol, a little bit of both that you're doing, now we can start looking at doing some of these deep dives into their work. Is some of this trauma based? We see a lot of drug and alcohol. We see a lot of substance use being trauma based. We see a lot of diagnoses related to personality disorders, as well as a lot of depression and anxiety, being linked in some form of traumatic event or situation or relationship, whatever it may be. So that's very much a thing. Somewhere along the line, we got this, they adopted all these coping skills, and these coping skills took them so far, but for right now, they're not working. So we need to find a new set of skills and help introduce those to them and help them monitor. That way they can start building this life worth living. Okay. All right. So what does this really mean? What are we looking at this point in time? The base to DBT is this little diagram that we have over here. You see that there's a Venn diagram. A Venn diagram is genuinely just the intersection of two circles, and the information and how it intersects. So we have our reasonable mind, we have our emotional mind, and we have our wise mind, right? So, in taking a look at this, when you think about this, I always try to kind of like characterize this and put this into some form of way to personify it. So if we're thinking of emotional mind, this might be a character or an idea or a person that is just absolutely like up all the time and activated, a lot. This might be someone who you would identify with the words very dramatic, or they're always over the top, or they get so very upset, or their feelings get hurt easily, or they have a lot of big feelings, whatever that may be, positive or negative, by the way. This isn't always just like a negative thing. So I always ask people, I'm like, what are some good examples of this? So I'm going to ask you guys this right now. Please do me a favor, type it in. Let me know what some of these are. What are some really good examples of some people that are over the top, that you can just tell their emotions just rule their lives? TV characters, cartoon characters, movies, celebrities. What are some examples?
Someone chatted, can't see beyond today, always needing to have the last word in conversations.
Right?
Someone said Britney Spears with a frowny face.
Oh, yeah.
Constant talking without considering others in relationship.
Uh-huh.
Teenagers, exclamation point.
I get that.
Harley
I get.
Quinn,
Oh, that's
narcissist.
a good one. Nice work. Fellow Batman fan there.
Use big emotional words. Someone turning the conversation to themselves and one-upping. The Kardashians. Someone else said teenagers. Everyone considered to be a Karen. That's funny.
Okay, these all sound like
Elon
really good
Musk.
ones. And Elon Musk. Okay, so aside from where are we at here? Kim Kardashian, Elon Musk, sounds like some teenagers, um, and dealing with a few other people. Harley Quinn, absolutely, that would be one. For those of you who are DC comic book fans or Batman fans, those are all
Someone said some politicians.
and some, yeah, politicians. I feel like there might be air quotes there or an asterisk or something like that. I get that. There's a lot of politicians, right, that are like that. And again, we're not going to sit here and make this political, but we do see a lot of that. So again, these people are absolutely larger than life. Is it completely damaging to everything that they do when they behave this way? Not always, but for many times it really complicates their relationships. It complicates how they communicate with people, and it also complicates how they're able to manage themselves. By the way, the example that I get the most, honestly, is the Kardashians. Drama. And that's hard, honestly, because if you think about that, if you are, and for any of your clients, as we're sitting here talking, I bet a couple of you had a client or two pop in your head. I'll scratch that. You guys probably all had clients pop in your head when we think about this. You think about that, they are constantly feeling. It will be like if somebody didn't have skin on and all your nervous system was completely exposed all the time, and all you were doing was feeling there was no reprieve. Can you imagine how exhausting that must be? That would absolutely be exhausting for them. And so when they come and they use the big words like, I am so devastated, or this will never be the same again, or I'm absolutely shattered with this information, when they use those big words, and please know it's not that they're trying to genuinely be dramatic. A lot of times that's because how they're feeling. Why? Because they're exhausted. These people literally are doing nothing but feeling all day long. Okay, they are super feelers. Okay, so that's why it's really helpful for us to help them through this dialectical behavioral therapy, because we're going to help them regulate some of that so that they're not feeling exhausted all the time. Okay. All right. So the other one, reasonable mind. Who are these people? It's all facts. It's all logic. What is that? Give me some examples. Who are these all facts, all logic, always in control?
Spock, engineers, Blanche Dubois from A Streetcar Named Desire, attorneys, Sheldon. Sheldon from I think he's from The Big Bang Theory. Teachers. Another person said Spock.
Right.
Bosses, type A individuals, scientists, doctors.
Exactly. So, and it's funny, actually, you mentioned engineers. I'm actually doing a training for a group of engineers on Friday. So, we'll kind of have to, maybe we'll put that out there to them. We'll see how very cold and clinical they are. But right, it's the same thing. So it's the exact opposite. So they're completely, it's not all that emotion. Now it's absolutely shut down. So when you think of Sheldon from The Big Bang Theory, or when you think of Spock, like Captain, that's highly illogical, right? So there's not even like a fleck or any intonation really like in their voice. There's no lilt. So it may be very hard to listen to them. And it's kind of like that idea of like just the facts. That's all that's happening. And you really kind of wonder, like, are these people more robotic than they are anything else? So, and some of that can genuinely be related to other things, including diagnoses. Sometimes you see those patterns with people that are on the spectrum, not always. But again, the thing is that they're really not having this feeling. So when you're interacting with this person, all they're doing is just pulling in this factual information and spitting it back out. And then people are looking at them going, why don't you ever fill in the blank? The most common one I hear is I'll have someone that is highly reason based, and it is their spouse, whatever it may be. And the spouse typically is very much the opposite. And that's their biggest frustration, is they believe that this other person doesn't love them. They believe that, this person doesn't care. Why? Because they're not showing it. And the reality is this person may genuinely be oriented where they cannot show those feelings, or those feelings are so closed off, or they don't know how to experience them, that it's just kind of pushed away. And honestly, it's scary if they start to have a big wash of emotion and they don't know what to do with that. What are they going to do? Well, they're going to double down. Why? Because they can't show that. Maybe they can't show that for a couple of reasons. One, maybe because they are super scared of losing any type of control. Or maybe they can't show it because they don't know what's going to happen if they do. Or they're super afraid of showing it because maybe it might make them look weak. We see this a lot with and again, I'm from rural PA, so we see this a lot in our area with how males in our area are oriented and raised, even up through current generations. You can't show that. You can only cry 3 times. Well, when can you cry? Well, I can cry when my dog dies. I can cry when the Steelers win the Super Bowl, because we're right outside of Pittsburgh, but that clearly didn't happen this year. I can cry when, I lose my parents. That's it. Those are the only times where I can show any emotion, and so we have to work on that. So that reasonable thing is going on there too. And that creates equal amounts of distress and honestly exhaustion. Because again, how much work are they putting into just keeping things down to like a very, very flat, dull roar? Or they become, they're doing more and more work and they don't understand, or maybe they're very frustrated or confused because they don't understand what they should be feeling or how they should be interacting with people. And they know that how they're interacting is not helpful to the situation, but they don't know how to put that in place. Okay. So nice choices, by the way, guys. All right. Go Chiefs. Well, I know. I get it. I get it. Wait, who won? I'm sorry. I'm not a sports ball person. Who was that? Was it? I feel like it was the Eagles, right?
The Chiefs won.
Oh, did they? Oh, okay. Thank goodness. Okay. That's wonderful. And I've totally lost half of you. They're like, oh my gosh, she doesn't even watch football. Get her out of here. I get it. So, all right. Last one. Who's our wise mind? Who is the person or who is that entity or whatever that you would picture that integrates all the facts and all the feelings and they hook them together to make some really good decisions? Give me some examples of those. This one's a little bit
We have Brene Brown,
nice.
counselors, Yoda.
Yes. Yes. Absolutely. Yoda is
A
always my
mother, Mr.
oh,
Rogers, Gabor Mate, nurses.
yep. Yep. Absolutely. And so being able to do that, researchers, yeah. I'm starting to see some of them kind of pop up here in the thing, which is good. So I can kind of read along with you.
Some said Oprah and the Dalai Lama.
Yes, absolutely. Because what are we doing? We're just integrating what is happening. And the one thing that we know is that when we are having any type of adverse experiences, right? Whether we're talking child experiences, thanks. Um, when we're talking about child experiences or we're talking about any type of like teen or young adult experiences as we're growing, any of these adverse experiences, what's this going to do? It's going to teach us to do or to not do something, right? And what happens is we're going to have this experience one way or the other. If we do not have the ability to integrate our emotions in the factual information of what's going on, we are going to jump automatically one side or the other. Okay. We're going to jump straight to Karen Kardashian. However, we're going to roll over here. Okay. I really want to show my age. One of the examples I always used to give was, Lucy from like I Love Lucy. Actually, in real life, she was not like that, but the character very much was, right? She was always kind of like in a snit about things going on or really excited. So we kind of go that way, or we also go the other way, which is being, in your reasonable mind, where people really shut everything down. Okay. So we're either going to open it wide open or we're going to shut it all down. And you know what? It doesn't work for dams like that. So it really can't work for us. So I want you to kind of think of it that way. When we are thinking about how these emotions work, we need to think of it kind of like a dam, right? So when we have dams and stuff like that and put in place, a lot of times there's valves, there's all sorts of things to make sure that we're able to regulate the water levels and so on and so forth. We do the exact same thing with Wise Mind to be able to regulate some of that emotion too. As a huge Star Wars fan, I always go with Yoda. Me and my Yoda coffee cup are not separated very often. So that is something, we want to think about that. We're just integrating these two things. So it can be yes and. All right, which by the way is kind of a neat thing. Just a little side trivia piece for you. If anyone is a fan of any type of improvisational comedy or improv, that is the core to learning that, which is the phrase yes and. And it's beautiful because it allows both things to exist. Okay. So the pandemic, it was, absolutely horrific. And it was just, we weren't able to get anything from it. And it has just absolutely deteriorated everything around us. Yes, it did do that. And if you're a therapist, a lot of us learned all about telehealth real fast. Did we all love it? No. But did it give us access to our clients in ways that we've never had before? Yes. Right? So you see, yes, and that's where we start finding that middle path. That's where we find that wise mind. Okay. So is it, again, is it something along the lines of, oh, you have your secretary who's been with you for a long period of time leave suddenly. Okay. Well, that's awful. So yes, that is bad. And this also is an opportunity to bring in somebody else who may have a different skill set or may have an even more enriched skill set that you weren't able to have with this other person. Initially, is it hard? Yes. And does it stay hard forever? No, because facts, feelings, situations that happen, it's all temporary, right? It's all water. Okay. The water's just kind of flowing right by. And so we notice this stuff. That's actually part of one of our DBT skills. We're not really going to get down into that today because we have a limited amount of time. But that is also something, we kind of think about is, just letting the thought just pass by. We don't have to grab on to each and every one of those thoughts. When Marsha Linehan talks about it, she talks about picturing it like clouds going by. Each thought is a cloud, or picturing like boxcars attached to a train and having it, just drive right in front of you. You're seeing those thoughts just go right in front of you. You don't have to jump on that. You don't have to grab those thoughts. We can just let them go. That's all right. We only grab the important ones, that really the ones that we kind of want to work with, or we have the capacity to work with. So ideally, if we are able to integrate this, the big three things that we are seeing overall is being able to have better critical thinking skills, better decision making, and ultimately less impulsive behavior. Okay. Which is win, win, win. Absolutely for all of us, by the way. This is not something that's just unique to someone who is going to see a therapist, for whatever situation they're going through, or working some form of program of recovery, or some sort of meeting in the middle. It's for all of us. I can't emphasize that enough. I highly, I challenge you, find me a reason not to have those three skills for any human being. Okay, will serve you well. All right. So I told you we'd kind of go through this a little bit slower when we talk about these pillars of dialectical behavioral therapy. So we're going to kind of do that here a little bit. But before I start, are there any questions, comments, concerns, anything that you want me to touch on before we keep going?
We did have just a few things come in. Let me pull it up. So one person asked, would a person with a paranoid personality be under the emotional mind?
Can be. Now, also too, if you're looking at someone who's paranoid, we could have paranoia, is for a lot of different reasons. We typically, when we think of paranoia, classically, you think of the diagnosis of like someone who's schizophrenic or a paranoid, schizophrenia with some form of paranoia. But that's not always the case. There can be paranoia that is surrounding trauma. There can be paranoia that is surrounding around their drug use. Quite frankly, yes. Is it a highly emotional in their emotional mind at that point? Yeah, absolutely. And at the same time, too, that's a little bit harder to deal with because you're looking at someone who's bringing in what they believe is factual information to support this paranoid thought. Okay, so that is something you can absolutely still use those DBT skills for, but depending on the person and the type of diagnosis, there may be some additional things that you want to kind of put in play there. Ultimately, too, if they're, actively, using, and the paranoia is based off of some form of substance, you're really not going to get anywhere with any of that if they're actively in that state. So that's just more best of like, medical interventions at that point in time or monitoring. Anything else?
We had a little bit of it's a little bit of a longer comment, and it's kind of a specific situation. Do you want to hear that now or save that till the end?
No, sure, let's bring it.
Okay. Someone said, I've been seeing a mental health client, no DNA, 2 times a week for 1 year in private practice. We read the DBT manual a lot, and she can do a few skills when we're together, but says she can never use skills on her own. She never leaves her house and has zero supports other than a dog. I'd like to refer her to a higher level of care, but she refuses or gets way worse and says everyone abandons me. SI and cutting are constant, not lethal though. Any ideas to help her use the skills on her own? I know I can't force her. I feel trapped.
Yes. And my heart goes out to you. And I've had a handful of clients in the situation, and please know you are seen. This is exhausting. It is exhausting for them to be feeling that way. And it's equally exhausting for us as clinicians because we throw all these things out, right? And nothing sticks. One of the things that I have had that did help a little bit, and again, it's really going to come down to them. Sometimes there's not a whole lot of success. You can keep offering those things. But there might be some things. And again, this was an excellent case. It sounds like to be able to staff with anyone that you have, if you have mentors, if you have anyone else going on, you were in private practice, I believe is what you said. So, if you have mentors, if you have other people to staff this with, it would be very helpful as well so that you have that support, so that you don't burn yourself out as well. But having her practice those skills on daily routines, that's where I would start. So if we are talking about mindfulness, she needs to come back and tell you how she was mindful about positive things, not negative. We want her to feel something really good. It's kind of gross to say it this way, but it's kind of like, got to be a bit of a used car salesman, right? You got to be able to sell why it's important for her to even try them in the first place, because she's saying that she can't. So, if you're looking at that, also too, what you're describing, there's a lot of dependent, a lot of dependent behaviors. I'm not sure if that dependent personality disorder there might be part of that or whatever, but with those things, she needs to be able to seize to have some successes. And the best way that we can have some successes is by doing very small positives. Things that are already going to be okay for her or good, we're just going to make them better. Okay. So, for example, your assignment is to describe to me what your favorite tea tasted like this morning. We're not going to use it to fix anything. We're not going to use it to change anything. All we're going to do it is just to augment what's happening for her to get a positive experience. That helps with that buy-in. And please, please know, like I said, I can't emphasize that enough. Please make sure that you're staffing with people around you, or at the very least, if you have a higher level of care, maybe sometimes too, being able to staff with them. If you can get a release of information, they might be able to have some ideas of ways to help her bridge that gap, because that's a very hard place to be. I hope that answered your question.
Thanks for that. And there's one more question. Does DBT teach assertive communication skills, as that can be a challenge for many?
All day long. It absolutely, absolutely, absolutely. When we're going to go to, that's actually the one of the last couple of pieces we're going to take a look at, and it's all about boundaries. And there's a fine line, right, between being passive or passive aggressive, or aggressive or assertive. And learning how to have that middle space and be assertive is huge, because that allows us to not only set the boundary, but to maintain it and be able to have the conversations in order to maintain that. If you want, if you're, whoever's asking this, there's a book. It's called Walking on Eggshells. And it is an excellent book. Look it up. Now, this is primarily for families that struggle with their loved one, struggling with some form of personality trauma, this, that, whatever it may be. Okay. But the reason why this book is so good is because it literally gives you ways, like phrases to use in order to maintain a boundary, or to set one, or to show different ways to make that stuff work. Okay, so yes, that assertive language is absolutely included in here. And again, please know, tip of the iceberg here. So we can go down that rabbit hole. I have a whole other training just on communication skills, and being able to put those in there and being able to kind of flip those scripts a little bit. So good question. And yes, we're totally going to see it. Okay.
I think that is it for questions right now, but feel free to keep those coming.
Yes, please, please. Otherwise, so that you guys know, I mean, I know that you guys are listening to me and I hope it's entertaining for you and you're learning something, but I'm also talking to you guys. I'm basically just sitting here talking to my screen. So it's really cool when we get to interact a little bit. So it's nice to know that there's people on the other side. It's a two-way street. So the thing is, regarding mindfulness, this is whole idea, like you see this, you see our little drawing here, right? And it says mindful or mindful. Right? So we got our person over there walking, and they're walking with their dog, and all they can think about is all the things that are happening. And honestly, I was kind of joke about it, but like, if you could ever just kind of like peep inside someone's head, people always tell me they have like thousands and thousands of thoughts going, and it's all sorts of different stuff. Excuse me. This is not even like ADHD related or anything like that. Just that there's so much going on all the time. And remember what we said, right? This whole idea of being able to kind of slow some of that down, and we don't have to bite on every thought that's there. Those thoughts are going to be there. We can't change that. It's how we decide to use them, or it's how we decide, to interact with those things, right? So then you go over and you look at the other picture, right? And it says the dog, and he's just like, this is a pretty awesome day today. They're just walking around. This is a perfect example of mindfulness. And many, many times I can tell you that I have thought about this over and over, because when I sit there and I look at my dog, and he just kind of giving me like that big brown-eyed look with his tongue hanging out, he's probably not really thinking like a whole lot. He's just happy to be alive, doing his thing. And honestly, it's a really good reminder that we can do the same. Even if you're not a dog person, like I said, it has nothing to do with that. Just this idea of recognize this. When you are mindful, okay, you are not attaching to all of those 1,005 other thoughts. They're going to be there. Those thoughts are there. There's nothing that you can do to just like magically snap and make them go away. Okay, so we just have to radically accept, that's another part of a DBT skill, that those thoughts are going to be there. And so it's a yes and. So yes, they're going to be there. And I do not have to touch each and every one of them. And I don't have to interact with all of them, because if I do, I know I'm going to get overwhelmed and I'm going to be exhausted too. So I can choose, I have the power to choose what type of thoughts that I'm going to interact with. And right now I am walking down, and it is a gorgeous day, and walking down the street, and it looks great. And you know what? I'm just going to be present in this moment right now and feel the sun shining on my face and look around me, and I look at all the trees around me and how beautiful it looks. Okay. And just maybe notice some fun things around, because otherwise, if I was worried, I wouldn't be seeing maybe some really neat things that are happening right in front of me, right? Like a kid playing with his dog, or somebody helping another person out. Okay. We don't seem to notice those things when we're all up in our head. Who is the author of Walking on Eggshells? I just saw that pop up. It is. Sorry, I literally just went over to my bookshelf real quick. The author is Paul T. Mason and Randy Krieger, Kreger, and Paul T. Mason, so Mason, Mason. Again, like I said, it really centers around borderline personality disorder, but ideally what you're looking at, yep, anytime. Ideally, like I said, it's something that you can like look at the conversations that are in there. Those are really good examples. That's why I like the book so much. Also, too, another book, just very quickly, is called Set Boundaries, Find Peace. That is pretty new. That just came out, I believe, within the past year and a half. And that is by Nedra, Nedra Tawwab, Tawwaab, I believe. So both excellent books when we're kind of talking about that and ways to kind of set those boundaries and be more assertive. So again, we're genuinely looking at being mindful, okay? Not just having our minds, because what are we doing? We're just basically kind of letting everything else rule us. We have no internal locus of control. It's all external. All right. And that's not what we want. You really want everyone else to be leading you around by the ear, or would you rather stop and you decide what you would like to do? And that's how we make a life worth living. That is how we show our clients that there's more out there, because it has been their relationships or their drug and alcohol use or their mental health issues or whatever it is in the world, maybe that they're dealing with or that they're worried about, that has been dragging them around by their ear. Now it's their time to stand. Now it's their time to stop in their tracks. And now they get to choose the direction that they go. Isn't that gorgeous? I love that thought. I love that thought of being able to have that inner strength to be able to make our decisions and to know that it's okay that we decide whatever we decide. So, all right, let's trucking along here. So we talk about distress tolerance, right? This is our next piece. And we look at the wise mind accepts. So remember, I told you there's going to be a lot of acronyms. This is one of them. Okay. The word accepts. You can see as you read it straight down there. And it talks about, I always kind of talk about it's the little things. When I introduce this to my clients, I always talk about it's the little things, meaning that you are going to do or manipulate something or have some sort of action surrounding what is going on. This is this idea of taking some form of action and putting that action towards whatever it is you want to do to be able to manipulate either that emotion or to do something in order to set the emotion aside. So obviously activities, go do something. Okay. You are really struggling and you're having a hard time, you finding yourself just zone out, go find something small to do, very simple. I don't care if you just like start, playing solitaire with yourself, or I don't care if you sort out your sock drawer, or if you do whatever. All you're doing is a simple task that's forcing you to concentrate somewhere else for a little bit. Okay. Contributing. Oh my gosh. If you have the ability, go do something for someone else. I know all of us here, we are all super healthy people. And we all have hearts of gold and we do that all the time. And at the same time too, finding ways that, our clients maybe support other people in a healthy way, not being steamrolled with their boundaries and not like having to do everything for everyone. But if it's appropriate and in a way that they can help someone else, that feels good. Okay. That feels good that we can do those things. Comparison. Now I know this is a tricky one, honestly, because when we're talking about comparison, we're talking about, basically what it looks like, you know, comparing like, oh, well, we think about comparing ourselves to other people. No, no, no. That's not what we're doing here today. Okay. Compare your situation to where it was, where you were a year ago versus where you are now. Where's your knowledge base? Did your knowledge base grow? Or maybe where you were 5 years ago versus where you are now. Look at you. You've survived. You've gotten through all these things. Honestly, we can all do this right now. The global trauma that was the pandemic over the past couple of years. Think about where you were somewhere around 2020, like a good chunk of the way into June or July, right? When everyone was still pretty scared. Or maybe early on before we were even able to get out and about. Now think about where you're at in relation to how we're managing things. I know it's not 100% great, but do you feel as anxious? Are we still at that point? Are we still as agitated? You're feeling different now. Why? Because you have new experiences and new information and new ways to help yourself, right? So good comparison thinking. Go do something to change that emotion. I always tell people working on, trying to do something the opposite. So it can be go put on a funny movie or put on some good music. If you are really struggling, and please forgive me, I could look her up, but I cannot think of it off the top of my head. There's a really, really great therapist on TikTok. And she has a phrase that she uses, and it's called dancing for dopamine. I love it so much. It is so beautiful. And it literally means like if you're just sitting in your chair and you're listening to some music, maybe it's just you tapping your foot, or maybe it's you just kind of like bobbing your head or shrugging your shoulders. All right. Or maybe you are having a full-on kitchen dance party, which I totally suggest. And I promise you, there's been many a kitchen dance party on Friday nights in my kitchen, because it just feels good. It just feels so much better. And you can slip around on the floor, by the way, better in your socks. Just saying. So check that out. But do something to switch the emotion. Okay. Is it going to make it fabulous forever? No. All we're looking for is just what it says, distress tolerance. We're just looking at how to manage the emotions that we have going on right now. We just need a way to walk through it instead of doing impulsive things. Okay, or maybe let's push it away. One of the things that I give people as an exercise is we work on what's called the container method. And it's very simple. It's just a visualization. I tell people to picture what it is that their mess or emotion or activating thing or trigger looks like. Some people tell me like it looks like a monster or it looks like this gross squirmy thing or whatever. And then I ask them what we're going to do with it. And they're like, well, I just want to get rid of it. I'm like, well, how are we going to get rid of it? And I ask people to use their imaginations. Are we going to put it in a box? Are we going to lock it in a cage? Are we going to like row out to sea and throw it overboard? What are we going to do? Let's put this thing in a container. Let's put this thing in a container, lock it up, and get it away from you. We can always open it back up when you are ready to work on those things. Rock on. But for right now, this thing is too big and too weird, and it's okay to not be okay. And it's also okay to get some help by kind of shifting that a little bit. And let's just shift your mindset on that. So sometimes that visual imagery is really, really helpful. Also too, looking at thinking the opposite. Okay. This is a phrase, fake it till you make it. I know fake it till you make it sometimes is also a little controversial, but thinking about ways that you would want to behave in the situation, right? That might be an option. And then finally, too, using sensations. Okay, observe that thing, whatever it may be, with as many senses as possible. Finding something where you can use as many senses as possible to observe or be part of a situation. The more senses you use, the deeper the connection, the better it works. Okay. So if we're talking about high sensory experiences, that would be, for example, taking a shower. You are standing in the shower. Okay. So you are physically feeling the water hit you. You are feeling the temperature. You can smell the scent of whatever it is, body wash, shampoo, whatever. Okay. You're able to hear the water falling. Okay. You really want to gargle with your shower water. You can taste that too. Okay. You can see the water running. All right. So you see, this is a high sensory experience, man. We put like all the senses in place. All right. So that's an excellent one. Being outside is another one. I have some clients, honestly, that really struggle and they're absolutely at their worst. I always tell people go outside in your bare feet if you can, if you're in a space where you can do that. Okay. I'm not talking like walking across a gravel driveway here. I'm talking like just go outside. I had one client, honestly, it was amazing. She was telling me about it. I just had to go outside. I'm like, okay. I'm like, so you did the thing? She's like, yeah. She goes, I did that on Saturday. And I'm like, holy cats. I'm like, it was like cold and snowy there on Saturday. I'm like, you were outside in your bare feet in the snow. She's like, yes. And it was amazing. And we talked about it. And I said, why is this so amazing for you? She's like, oh, she goes, because it totally shifted it. She goes, all I could think about was how cold my feet were. I couldn't think about like all these other things that were going on. So it was just that shift, just for a little bit, to get things going. And thankfully she did not stay out there and she was getting like frostbite or some sort of like hypothermia. But at any rate, the thing is, it's just that shift in those senses that make all the difference. I can't emphasize that enough. With some of our clients with self-harm, one of the classical things that we use is we ask them, instead of attempting to cut themselves or burn themselves or whatever, scratch or whatever, we ask them to hold an ice cube, right? Why would we ask someone to hold an ice cube? Because you hold that long enough, like you're actually going to feel some sort of like physical like sensation. It's going to be cold, and then that cold's going to start getting painful right till you drop it. It's the same thing. So again, being able to kind of see that stuff rolling, that's the thing. We're just shifting into those different senses, and sometimes we force ourselves to observe those senses, and it snaps us out of where we're at. Thoughts, comments, questions as we're going?
We haven't had anything new come in since the last time we stopped.
Okay, sounds good. Just checking in. All right. So our other piece here is when we're looking at emotional regulation skills, right? This is part 3 out of our 4 pillars, is us looking at accumulating different types of emotions and how we're going to process them, right? So there's 2 things here. There's 2 acronyms. One is the ABC and the other one is please. Okay. So how do we help regulate some of these emotions when we're looking at this stuff? Ideally, we want to look at, our ABCs. A is for accumulating positive emotions. Do something that feels good every day. I'm sorry, somebody just popped in a thing and said early in sobriety, and then I missed the rest of the comment. What did that say?
It says, during early sobriety, I watched funny animal videos and the ridiculousness show to help me.
Yes. Yes. 1,000 times. Yes. And some of us may still do those things. I get that. It feels good, right? We just need to have that shift. So absolutely, like I said, having this, accumulating this positive emotions, do something every day that feels good, and you make that part of your routine. Many times we do things because we have to do them, right? You get up at 7 a.m. Why? Because if you don't, you're going to be late for work. All right. Or you put on pants today. Why? Well, because we had to go in the office, right? It's not socially acceptable to not wear pants when you're in the office. Whatever it may be, okay? You do these things because we have to. All right. I'm talking about doing something that you want to do, something that makes you feel good. We are so in tune right now with doing things that we absolutely have to do that it just, honestly, it just kind of erodes at us. It really just, eats us away. The whole idea of just having to do things, right? Let's do something that you want to do. Make it something small. Make it your favorite coffee in the morning. Okay. Or, have some quiet time, 10 minutes before you leave, just to set your day and look through some really cool pictures and maybe it's some vacations that you like to remember. Maybe it's reading a passage. Maybe it's putting on some really good smelling, lotion. Maybe it's wearing those favorite pair of shoes. Maybe you have that outfit that just says like, bam, I am here and I'm looking good today. Right? Whatever that may be, listen to your favorite music on the way. Many times we get so caught up in what we have to do, we have a very hard time thinking about how we want to integrate things that we want to do. Okay, you have to be able to integrate that, because if you don't, right, what are you doing? You're just wearing yourself away. You're just eroding at your being at that point in time. The other one, B, is building some mastery. Okay, do something over and over again as a healthy routine. Do yourself a favor and maybe you do like 10 high leg lifts in the morning just to get your body moving and plumping. Okay. Or maybe you have some routine. People think about routines all the time, but there's all sorts of different types. So maybe it's something that you absolutely remember that you're going to be brushing your teeth every morning. Okay. You make a point of it. Got a new toothbrush and everything. All right. Build some healthy routines. Make sure you have that glass of water in the morning before you have anything else. Maybe that's something. It doesn't have to be physical. It can be all sorts of things, right? But doing that over and over is going to bake that into your routine. And there are two things in this world that I can tell you that really, really, really affect our ability to learn and our ability to change. And one of them is routine, and the other one is sleep. Okay. Sleep's like the ultimate regulator. And I just said that, and I bet half of you, like, eyes rolled. You're like, oh my gosh, I wish. Okay. Because that sleep dysregulation that happens as it's related to mental health, as it's related to substance abuse, as it's related to physical issues, who knows, whatever else. Okay. That's going to set you up for the day, regardless of how good or bad it was. So work on that with your clients. That sleep hygiene is important. Outside of that, make sure that you have this core routine. If you think about it, you probably do maybe like the same 3 to 4 things every morning when you first get up. And I bet you even do them in the same order. Okay. But when things are really, really, really bad, even those base things may fall away. That might be a thing. Okay. Keep those routines, keep that good sleep stuff. That's important. And finally, C, make it easy to use. Cope ahead of time. Have that proactive piece rolling. One of the things I have when we talk about mindfulness, I have someone build themselves basically like a mindfulness toolbox. Okay. And that can be anything. I always tell people any sort of sensory related stuff that feels good. Many times when we think of sensory related stuff, we think of our clients that are, somewhere on the spectrum, but that is not the case. We all have sensory needs. It doesn't matter. All different ages and stages, right? We all have favorite smells that take us right back. We all have certain things that feel good, right? So do that. Keep something there. Keep your favorite flavor of gum, and maybe something really, you have a rock that like feels really good. Just kind of rub maybe between your fingers because it's good and smooth. Or Maybe you have some, favorite hand lotion because you love the smell, right? Or a candle, whatever that may be. Have that stuff in place. Okay. Maybe you have some pictures that you love to look at or some music that you love to listen to. Have that accessible. Super helpful. And finally, we go on to please. So when we talk about please, we look at, making sure that you treat what ails you, even the little things. If you've got a cavity and you haven't gotten that filled, go get that filled. Okay. It's those little things. It's amazing the little things that kind of wear away at us. Like I said, it's all about eroding. It's not one big thing that's going to slam you down. It's 1,000 little things, right? Balancing your eating. Okay. And again, avoiding those mind altering drugs or alcohol or whatever. Again, easily said, I get that, but recognizing how that's an issue. Also, too, I talked about your quality of sleep and exercise. If you don't move it, you lose it. Okay. And I'm not talking about like sitting and then losing weight, because that would be awesome if that's how it worked, but it doesn't. I'm an absolute example of that. So, but at any rate, the thing is, it's just this idea of, finding some sort of way to moving your body. It's very important. Your brain and your body are connected. I promise. They do not work independently. So when your body is feeling good, I promise you, your brain's going to be feeling better too. All right. And then lastly, we talk about our interpersonal effectiveness skills. Okay. And I have 3 acronyms that are here. It says Dear Man, Give, and Fast. And it's kind of in a triangle here because they all play off of each other. Okay. Dear Man, basically what it is, this is how you are going to hear something and make a request and kind of ask for what you need. And the self-respect thing is basically how you're going to defend that request or defend that boundary and maintain it. All right. And the other part of that is when you can set a boundary and maintain it, and you feel how, like, you tell people how you would like to be treated, or you're able to ask for what you need. All right. That also improves the relationship. And now we can have that interpersonal piece going on. Okay. Asking for what you need is a huge issue. To be seen and to be heard as a human being is like some of our core stuff. Those are things that we do with our clients every day. And those are things that they need so desperately. So finding ways to help them have that. All right. Looking at ways to set and maintain those personal boundaries. I cannot emphasize the boundary thing enough. Like I said, that is probably of all the trainings that I do a lot with dealing with burnout, but right up there is boundaries over and over. So that is very much a thing. So individually, when we talk about these 3 pieces, we talk about Dear Man, Give, and Fast. We look at Dear Man, and again, it's an acronym. So what this is here, by the way, this is not any of my work. That would be so cool if it was, but this is not. This is actually from Marshall Linehan stuff. And then there's this really great resource. If you do not have it, it's called therapistaid.com. There are a ton of free worksheets and ways to discuss some of these big events. So I highly suggest, as a therapist or as, just someone who's kind of some sort of newly helping professional, look through some of this stuff. It's not rocket science, but it's a really great way that things are laid out and presented. There's a lot of different topics that you can search on, and it is all free. So good resource. But again, it has describe what you want, express why you want it. The A and the S on the emotional regulation skills. Is that what you're asking for? What was that question again that was on there? Oh, okay. All right. On the emotional regulation skills is avoid mood altering drugs and balanced sleep. So A is for avoid and S is for sleep. Okay. So like I said, you go through and you basically, this is about you asking for what you need, right? We're going to ask for what we need, why we want it, why it's important to us, reinforce why it's important, being able to be mindful in the moment so we can just kind of sit with whatever we get, because we may not get what we want, right? We're going to try to negotiate. We're going to try to feel confident in it. Okay. But we're still going to ask, and learning how to ask and learning how to use your voice is core, absolute core to our clients. And many times that ability is taken away, specifically in addiction, because we see that, honestly, it's the drugs or whatever that's speaking for them. It's no longer them. When we talk about fast, this is the other part of it. So we set the boundary, and now with fast, we're going to maintain it. So we are going to be fair about whatever it is that we're hearing. If someone's trying to steamroll our boundaries, we can say, you know what? I don't I don't allow people to speak to me that way. If you continue to speak that way, then I'm going to remove myself from the situation. So I'm going to be fair. Okay. Apology free. I'm not going, oh my gosh, I'm just so sorry. I just don't want you to think that I'm just some sort of weirdo or whatever, but like I just can't do this anymore. No, there's no apology here. Apology. You are just as important as every other person here. So like let's take a look at that. This is part of this assertive language, by the way. We had that question earlier in the session. Also, too, sticking to your values. Do not let someone steamroll you. If it is really, really important that this person, for example, stay monogamous because that's the style of relationship that you can appreciate, then that's your line. If it is a hard stop, then it's a hard stop. And that's okay because it's for you. And also, too, being truthful. You're not going to sit there and go, oh, well, it's really just because of Susie's older brother. That's why we're all kind of dealing. No, it's not. It's because you don't appreciate how you're being treated. And that's okay to be truthful. Okay. Easier said than done, though. I know what I'm saying. This could create a lot of anxiety and a lot of stress and upset in trying to do this, especially for someone who's not used to doing those things. I cannot emphasize the enough of role play and practice, 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 practice. Okay. And our last one that we have here with our interpersonal effectiveness skills, we talk about give, right? So this is how we want to keep that relationship flexing, right? So we're going to ask for what we need. And then when we're able to get it, if someone tries to steamroll that boundary, we're going to kind of stick up for ourselves and say, hey, no, we're not going to do that. But I still want to have this relationship with you. So I'm still going to try to flex this relationship with you in some way, shape, or form. So I'm going to be gentle. I'm not going to sit there and as soon as somebody says something, you're like, well, that's it. I'm done. And then we're going to call them every name in the book. Okay. If they're constantly coming at you and you don't understand why they're doing this, get interested, get curious. Why is it that every time you and I talk about the bills that you become really agitated? Why is this happening? I don't understand, because in my world, I know we just have to pay them. But every time I talk to you, specifically the bill around the car, like that sounds really upsetting. Like what's going on there? And then you validate, just as I did before, right? That sounds really upsetting. That's a good way to validate. And we show people how to have those conversations and be able to validate the other person. Again, we all have our opinions. We all have our ideas. We can validate and see and hear people, okay, and still have those boundaries at the same time. And lastly, having an easy manner. And this is very much easier said than done, okay? Because we're already probably feeling pretty emotional and it's hard to have this, but recognizing that, nothing bad is going to come out of this right now. We are just gathering information. That's all we're doing. We're just kind of trying to understand what's going to happen next, right? And so that's part of that language and part of that assertiveness too. You don't have to be assertive and sticking your finger in someone's face. That's not assertive at all. If anything, it's very much aggressive, right? So those are all things to look at. Again, tip of the iceberg. But I have to say, there's some excellent DBT memes out there. You can go search these. But by the way, these are like two of my favorites. I know, and I'm old, by the way. You can see how my favorite memes, I'm pretty much aging myself on some of these. All right. So, kind of having that in a little tongue in cheek as far as looking at how people see things or whatever. But there's a lot of stuff out there. There's a lot of ways to work with this DBT, by the way, through social media. There's a lot of different outlets. But again, please make sure that your outlets are pretty reliable. There are on TikTok. There is DBT TikTok and there's therapy TikTok and so on and so forth. I've used a couple of those. I've had clients bring me examples of what they're feeling, showing me a TikTok thing, and then we kind of use that to talk about the DBT skill or whatever it may be, or using memes or whatever it may be, different types. Okay, so again, here's sort of a resource list. I know I gave you some book recommendations as well. You can check those out. And also too, you'll have my information on here. Jessica, you asked, how do you get comfortable naming emotions? Basically, it's practice. So a lot of times when we look at being comfortable in naming emotions, we're going to look at not the emotions maybe that are happening right now. We're going to maybe look at a previous event, and like that's where we would start. And then we would start naming emotions just as maybe they come into the session or as to what they're doing. What's your emotion like today? What emotion do we have going on? Sometimes we use what's called a feelings wheel. If you Google that, you can find there's a bajillion. It's pretty much a standard thing of all different lists of feelings and how they connect to other feelings. And you just kind of take a look at that and identify it. Don't wait till that feeling is so big and huge that they can't identify it. We're going to get them to practice being successful with their everyday stuff. And they're going to look at you and they're going to roll their eyes and you're like, oh my gosh, why are we even doing this? It's not even working. We are building so that when things do become hard, when you do feel compromised, you have these skills in your back pocket and you're able to use them. So one way to help people name their emotion is they come in every day. You know what I mean? All right, hey, before we get started, what's the emotion? What's sitting in your brain right now? You know, they're like, well, I don't know, I'm just kind of here. All right, well, just kind of here. So what does that feel like? Is that like an apathy thing? You can work on that. Sometimes you can, again, we're not directing them towards their emotions, but we can maybe name some examples. We can use a feelings wheel that way. Was there another part of that question?
What was the original question? I'm sorry.
It had, I think it was the last one, and it asked about how do we help people name their feelings?
Okay, they must have just sent that one directly to you. So I'm not seeing that one.
Okay, yeah, it just
Somebody
popped up.
did
I just
ask.
saw it pop up quick. Oh, there we go.
Oh, there it is.
Especially when they are really defensive. Yes. So normalize the defensiveness. You're going to validate that. They have every right and reason to be defensive. It's okay. Let's call it. Let's just call that elephant out in the room. And it is perfectly okay that you have that. Because you know what? You have a reason. There's a reason why you're defensive, because things didn't go your way, or maybe you always had to defend your choices, or maybe you were so used to having everyone yell at you that you basically, it's a skill. It's a coping skill. And that's okay. It's okay for things to be messy. I think that's a lot of times when people think about coming into therapy, right, or getting into recovery, that they're just going to magically make things clean and pretty. And that is not how any of that works ever. So we kind of have to, allow that, validate it, let it be okay, let it sit in the room. Okay. And everyone has examples of being defensive, and that's okay. As far as that stuff goes. And lastly, please, and again, I told you I'm a huge Star Wars nut. So there's my Yoda, and here's my favorite Yoda quote: "Fear is the path to the dark side, because fear leads to anger, and anger leads to hate, and hate leads to suffering." You think about that. You think about all the fear that we went through over the past couple of years, and when that really got pushed. Yeah, go ahead.
Someone in the comments said, "May the force be with you," in all caps.
And also with you.
And I agree, as a fellow Star Wars fan, I love ending with a Yoda quote.
Yoda is the man, or
Yes.
entity. Actually, I really don't know if there's anything attached there he's identified with, but who knows? They never said that. Regardless, like I said, so you think about all that fear and what happened when that fear got big, big, big. What do? We started seeing people getting real angry, and that anger turned to hate, and then that hate turned to suffering. Okay, so we want to work on not having that happen. It's already happened. So how do we manage that along the way? We use some of these DBT skills. My contact information is here. It's Angie at C as in cat -NTA.com. Please do me a favor and email me. I absolutely love hearing from my attendees. I love hearing questions. If there's ways that I can direct you to information. If I were a dragon and I had a hoard, my hoard would be information and books and so on and so forth. So at the very least, I might be able to point you in a way to get some more information or to help you out with that. Outside of that, please know this is one of probably many, many, many different trainings that I do. If this is something that you really like, we can have this brought to you or in other places and spaces. So please get in contact with me as well. But thank you so much for interacting with us. I had an awesome conversation. I appreciate it. Anything else you need, though, please let me know.
All right. Thank you so much, Angie. That was a super informative webinar. I know I learned a lot. So if you want to stick around, I'm just going to be going over some quick housekeeping about CEUs. We would like to remind all participants that a PDF of today's PowerPoint, along with the recording of today's presentation, will be uploaded to the webinar library located on IREDA's website sometime within the next week. We will also be sending out a reminder email with that information. Please excuse my dog. He's ready for a break. Once we have these resources posted, we'll be sending an email with them. I now want to remind you all of our evaluation and CEU process. You will receive several follow-up emails. The first email will include a link to the evaluation, and the second email will include a step-by-step instructions on how to obtain CEUs. Please note that it will take up to 48 hours for your CEUs to become available because we have to cross-check your attendance records. We would like to specially request that you fill out our evaluation. It should take no longer than 2 minutes of your time. Again, we would like to thank everyone for taking time out of your day to participate in today's webinar. If you have any questions at all, please email us at info@ireta.org. And I just would like to thank Angie again for such a great webinar, and thank you everyone for attending. And with that, we will conclude the webinar. Thanks and have a great afternoon.
Thank you. Enjoy your day.
Thanks, Angie. Bye, everyone.